Hello everyone, welcome to my YouTube channel. So I'm going to be doing this presentation that is a question associated that I retrieved regarding American Society for Clinical Pathology exam. I'll provide answer and I'll try to provide further comment where possible. Okay, so this question is going to look at something like antibody screening interpretation, like in case of if there is antibody, whatever, what are you going to do and all of that. So I'm going to just go by the question, the way it is asked. Okay, I'll try not to teach, but I'll try to explain to further bring clarity where possible. Before we continue, my name is Dr. Emmanuel Elodo. I'm a biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. All right. So now look at this question. So I know I'm putting the answer there, okay, or maybe putting like anti-K patient, okay, but I want you to know that when I'm getting this question, they don't give sometimes there's a giveaway I do. It's not really the case. So what they've done was to say a patient's antibody screening is positive. Remember, when the antibody screening is positive, then you do the antibody panel. Don't forget that, okay? All right. A patient antibody screening is positive, the panel reviews. That means after the antibody screening is positive, then you did the antibody panel. So the result you got was anti-K. That's just what this is saying, okay? Let me read it. A patient antibody screening is positive. The panel reviews the presence of anti-K. The patient needs a transfusion, okay? The question now is, what is the most appropriate next step to take? In other words, so if you are going to issue blood, what are you going to do? So this person has antibody K, okay? What are we going to do? One, issue blood or RH-negative blood, provide cross-match-compatible blood, provide K-negative red cell blood, give on-cross-match emergency blood. So which one are we going to do? I think the little background thing I'm going to provide here is the fact that you must know the fact that one, that the fact that the person has developed antibody K, okay? You've done the antibody screening, is positive. You've done the antibody panel, it is antibody K. Like I've mentioned on my previous video, I have video on antibody panel and I explain all of this. So look out for that, okay? Right, so now for the fact the person has antibody K, it means that the person does not have antigen K. That's just what it means, okay? So when when we look at antibody, it can be either allo antibody or it can be auto antibody, okay? So when somebody acquire antibody due to exposure of antigen that he or she doesn't have, that antibody the person acquired is called allo antibody. But if somebody start responding against his own antigen and as a result develop antibody, because it was not acquired, is self-attacking self, that is called auto antibody, okay? So now, but I think that this presentation obviously is acquired antibody, that is allo antibody, okay? Right, so if this person has developed anti-K, it means the person does not have antigen K. So what it means is that when you want to issue blood, I already know the answer to this, I just want to explain it to you. When you want to issue blood, you must know that the blood you are issuing red blood cells, okay? So remember that a whole blood contains red blood cells, white blood cells, platelet, plasma, okay, and all of that, okay? So when we give blood component, we may be giving either red blood cells, we may be giving platelet, we may be giving fresh frozen plasma, or we may be giving cryoprecipitate. Sometimes we can give leukocyte as the case may be. But in this context, you want to issue blood, what are you going to give? The answer should be what? C, actually, okay? The answer should be C, okay? So what you need to do is to provide cross-match-compatible blood, okay? And this cross-match-compatible blood you are going to provide, you need to provide K-negative red blood cells. But remember, this person does not have antigen K. That was why the person developed antibody K. So the reason why I make this is that you need to go and get a blood. Let's say the person is A positive, okay? You now need to go and get, blood group A positive that is antigen K negative. Then do a cross match, okay? You can only issue the blood for the fact that if it is compatible, okay? That means if there's no reaction. So, but you are going to provide a K-negative red blood cells and then you cross-match it, okay? That is the answer. Because if somebody develop antibody, it means the person does not have the antigen. Therefore, when you want to give blood, because the person doesn't have the antigen, you make sure that the red blood cell you're going to give the person does not have the antigen of that antibody the person developed. Remember, the person developed the antibody because the person does not have the antigen. So when you are selecting blood, you select that antibody, you select the antigen negative. and then do a cross match. And if it is compatible, you issue the unit, and that's what I meant here. So the answer here should be C, which is provide K-negative red blood cells. Okay, so you go and get K-negative red blood cells, okay, and do a cross match with the patient sample, and if it is compatible, then you can issue that. Okay, right. So why is this important? We must know that antibody K, which is under Kell family, okay, is a clinically significant antibody, okay, and of course, a patient must receive antigen-negative unit whenever they have the antibody, okay. It's not just about anti-K; it can be whether anti-Duffy A, anti-Duffy B, anti-D, anti-C, and all of. So once somebody develop any of the antibodies, if you want to give the person blood, ideally, especially for clinically significant antibody, you select the antigen-negative and cross-match and give it to the person. So you may go for this exam, you may not see anti-K, you may see anti-C. It still remains the same thing. So if this was to be anti-C, it will be provide, C negative red blood cell. That's what it's going to be. So what you're providing is the antigen negative. I hope that makes sense. So I have videos on this already, so feel free to watch them. But yes, the answer is provide K negative red blood cell, okay, which is C. I hope that makes sense. Okay, all right, thank you so much for listening. Please feel free to ask your question, put your question on the comment section. I'm more than happy to look at that. And please, can I ask you to like, share, subscribe, comment, okay? Remember, one of the ways to appreciate the effort in making these videos is to subscribe, is to comment, is to like, and also it is to share. So please subscribe, like, comment, and share, okay? Right, so feel free as well to contact Too Good Consultant Limited if you need any help, either with your exam preparation or interview preparation or academic or career support. We are more than happy to support you where possible. All right, thank you so much, and I wish you all the best till I come back away again. Bye-bye.